Here I am at the warm shelter. Tonight is a health screening here at First Baptist. If it wasn't for Robert, Deborah, and the warm shelter staff, to the people that make this shelter possible, a lot of us would be out on the streets, no health screenings whatsoever.
Dylan Kennedy was among more than 35 people who recently found warmth inside a cold weather shelter. Waynesboro Area Refuge Ministry, also known as WARM, partnered with Augusta Health to address the issue of poor health care among homeless people.
We are hosting our warm cold weather shelter at First Baptist Church in Waynesboro and having a site visit from Augusta Health and the regional free clinic for their new initiative, Healthcare for the Homeless.
Deborah Freeman-Belle is the executive director of WARM. Freeman-Belle estimates nearly 60% of the shelter's guests took part in the health fair.
Those folks are getting health care access and preventative services and some other checks from the nurses who are on site.
During the winter, WARM's thermal shelter moves from church to church weekly. Augusta Health nurses visits the WARM shelter once a month.
They do checks that focus on chronic health and diabetes and preventative measures. They also have done some immunizations and really help with health knowledge referrals and helping people understand what they can do while being homeless and maintaining their health.
Jan M. Swaller is an RN health educator with community outreach at Augusta Health. The nursing staff provided health screenings including mental health, blood pressure, and diabetes.
We also provide referrals into primary care or mental health as needed based on their screenings. Persons who are stressed about trying to find housing, sometimes they're so worried about housing and where they're going to sleep that they don't always take the necessary steps to look after their health. And so we're here trying to encourage them to do that and to help them link into primary care also.
Robert Bell is the warm shelter manager.
A lot of our guests, when they're out on the streets, they don't have access to medical care. They kind of let themselves go. And so when they come in here, they experience hope. And so they actually are receiving something that they can't afford free of charge, provided by Augusta Health and WARM.
The Virginia Department of Health provides immunizations to prevent influenza and other diseases.
The immunizations are important. This population, and especially like here at the thermal shelter, they're living in many people, and it's good space, but it's still close quarters. And so this being flu season, we want to be sure that people are getting vaccinated for the flu to try to fight that.
Dylan told me he had blood pressure and diabetes screenings.
They're no good for me. I'm not at risk, but thank God.
Talk to me about it.
Well, when I got the diabetes screening, they said I'm not at risk, but I'm still scared, so I'm going to talk to the doctor when I can get a chance to go to him.
But he says things didn't go as well during his blood pressure check.
They said it was a little elevated.
He blames his high blood pressure on stress.
Being here, trying to find a place, dealing with family issues, just But I'm trying to go through it by the grace of God, so.
It's about caring for our neighbors. It's about caring for people who are experiencing rough times. So I think it's about us being able to reach out to them and to provide services that they might have difficulty accessing otherwise. But when they're here at the thermal shelter, we can come and meet with them here, have conversations, find out what the barriers are for them to reach the services that they need and try to help them overcome those barriers.
In Waynesboro, Elaine Rackley for Breaking Through News.